The opioid crisis is destroying lives and tearing families apart. Each day, over 130 people die from opioid drug overdoses. The government is spending a lot of money and using a lot of resources in order to try to contain the spread of this crisis, as well as to treat the people that are already addicted. 80% of heroin drug abusers have claimed that in the past they had abused opioid prescription medication. This is in large part due to exploiting weaknesses in the medical system, which allows them to become overprescribed and to get more medication than what they need to manage their pain. Today we have a few solutions that we'd like to show you that can help to contain the spread of this epidemic, as well as preventing people from getting addicted in the first place. For example, we have a patient addict who's trying to get as many prescriptions as possible from multiple doctors. He's first going to go to an urgent care center trying to get a prescription for knee pain that he's experiencing. He's going to see the urgent care doctor, and at that point the doctor is going to make the assessment that he's going to prescribe him pain medication. From there, he logs into his mobile application and acquires the key identifier for that patient, so let's say a patient health ID, and at that point he can see that patient's prescription history. From there, he decides to add a prescription, which will then automatically generate a prescription for that patient, and he'll be able to share that prescription either by emailing it or printing it out. He decides to email it to him, and having satisfied the patient's requests, the patient's going to leave, and then trying to go to multiple other doctors to get more prescriptions. Now our patient addict is going to go to an emergency room to try to get some help for some extreme back pain that he's complaining about. The ER doctor is going to take a look at his back. He made an assessment that he's going to prescribe him opioid medication, and from there he logs into his mobile app, requests for his patient's health ID, and he can see that in the past 24 hours there's already been a prescription made for that patient that hasn't been filled yet. So at that point he chooses not to prescribe him any more opioid medication, and also makes a recommendation to the patient, suspecting that he has some kind of opioid addiction going on, to get some help, and trying to connect him to a nurse case manager for addiction. The patient refuses at that point and leaves. Now that the patient hasn't been successful in getting multiple prescriptions, he's going to go to multiple pharmacies to try to see if he can use his one legitimate copy of a prescription and get it filled multiple times.
The opioid addict then goes to the pharmacy with the valid prescription he has, having downloaded it onto his cellular device. He then presents it to the pharmacist. The pharmacist logs into their system and scans the prescription in order to verify that it is legitimate. He then hands over the custody of the medication to the patient. The opioid addict then goes to another pharmacy across state lines, hoping they will accept the prescription copy that he has. The pharmacist then scans a copy of the prescription, and an alert pops up, stating the pharmacist of the prescription being used again. The addict then leaves the pharmacy, having been unsuccessful in getting his prescription filled multiple times.
The personas for this architecture are the doctor, pharmacist, and the nurse case manager supporting the patient. They are omni-channel enabled and can work through a web browser or mobile application. The mobile app securely connects with Identity Cloud Service to the rest of the cloud services using Oracle Integration Cloud Service connectors. Blockchain Cloud Service is the distributed ledger in which actions and events are being recorded. The movement of medication through the supply chain is tracked by Supply Chain Management Cloud and integrated with Blockchain Cloud Service. The Nurse Case Manager for addiction treatment can support doctors seeking addiction treatment for their patients using Service Cloud as their interactive tool to manage addiction cases, using management tools and a knowledge base in the same module.
Using blockchain technology to track prescriptions, pharmacies' drug transactions, hospitals, pharmacies, and government leaders can limit the opioid addicts or black market sellers from illegally accessing these controlled substances, and can help to effectively contain spread for opioid addiction crisis.